Minimally invasive glaucoma surgery uses microscopic equipment and tiny incisions to treat glaucoma. MIGS procedures have been designed to be safer and speed recovery. We recently sat down with Dr. Berdahl at Vance Thompson Vision to learn more about the different types of MIGS and how doctors determine what's best for their patients when it comes to treating glaucoma. We're at Vance Thompson Vision, and we are talking about glaucoma and the different treatment options available for it. Dr. Berdahl is joining me today. Thank you so much.
Good to see you again, Brittany.
Let's just start off by talking about first glaucoma. What is glaucoma?
Yeah, so glaucoma historically has been kind of a nebulous disease. It's a disease of the optic nerve. The optic nerve connects the eye to the brain. So the optics of the eye focuses light on the retina. The optic nerve carries it to the brain processes it and creates an image. So think of it as the cable that processes images or that transfers images from the eye to the brain. That deteriorates. The biggest reason it deteriorates is because of high eye pressure. But 30% of people in the United States that have glaucoma never had a high eye pressure. Only 5 to 10% of people that have high eye pressure even get glaucoma. So it's not just about eye pressure, and some of our research has really helped redefine that, which is that glaucoma may be a two-pressure disease, a balance between eye pressure and brain pressure. And if those balance out, you won't get glaucoma. But if the eye pressure is high or your brain pressure is low, you can get glaucoma. Then what happens is you lose your peripheral vision. So one of the things that is difficult about glaucoma is you can have real severe glaucoma and not know it yet, because you don't realize you're losing your peripheral vision. And so what we want to maintain is all of that visual field, so as it gets closer and closer to the center of your vision, you don't lose that precious central vision.
So can glaucoma be prevented?
It can be prevented, but it can't be undone. The name of the game in glaucoma is all about prevention, and the way that we prevent glaucoma is by lowering the eye pressure. So we can't make you better, but usually we can stop you from getting worse.
What are the different treatment options available for glaucoma?
All of the treatments for glaucoma are centered around lowering the eye pressure. There may be new things in the future that can treat other parts of glaucoma, but for now, all of the treatments are about lowering eye pressure. And the good news is we've got more treatment options than we ever have had before. In the last year, 2 new drugs for glaucoma have been approved. So that gives us about 10 different medications that we can use. We've used lasers for a long time. And then there's this whole new category of glaucoma called MIGS, which stands for Minimally Invasive Glaucoma Surgeries. And that probably started 8 years ago with the Glaukos eye stent. And since that time, there's maybe 10 to 12 different surgical approaches, all that are minimally invasive to help prevent glaucoma.
Let's get more into detail about MIGS. Can you explain what that option is?
Yeah, so traditional glaucoma surgeries are pretty tough. I mean, we do them if we need to do them, but they have higher failure rates than we'd like and more risk than we'd like. And so there's a new category of MIGS that creates internal drainages inside the eye. And you go through the same incision that's only 2 millimeters wide that we do cataract surgery through. What it really does is it creates an internal bypass. The fluid all stays inside the eye to lower the eye pressure.
Why is MIGS such a big deal? I mean, you said there is multiple treatment options.
It's all about safety. It really is about safety. You know, we're trying to prevent people from losing visual field, but if we do a surgery that didn't turn out very well, then we caused the loss of vision from it. And so MIGS is as safe as cataract surgery, and cataract surgery is one of the safest surgeries in the world.
So if you have all these treatment options available and MIGS is one of the safest and the one that you do the most, why are there these other options? Are there only certain people who are candidates for it?
Yeah, that's right. There's only certain people that are candidates for it, and it's really hard to take a low eye pressure and make it lower. So we still need our traditional surgeries to take somebody whose a normal eye pressure is 10 to 21. Okay? But some people, if their pressure is 14, pretty low in the normal range, are still getting worse. It's really hard to take that 14 down to a 10 or a 9. And that's why we need those traditional surgeries. But MIGS is a great option if your pressure is 22 and your glaucoma is mild or moderate. That's the right place to start.
Is there only one category for minimally invasive glaucoma surgery?
The category is defined by going from the inside out, not the outside in, kind of almost like laparoscopy, except in the eye. It's characterized by its safety profile, and it has to work. So those are the three criteria that need to be met for it to be called MIGS.
Would you say that MIGS is very successful?
Oh yeah, it's very successful. You know, sometimes it takes doctors a long time to adopt technologies. We're lucky because we're in the clinical trials. And so we do the FDA monitored work to help determine, is it safe? Is it efficacious? And then after it's implemented, we've done some of the largest publishing in the world on MIGS.
Where are advances heading in terms of glaucoma research in the future?
I think that it's going to places that are beyond just lowering eye pressure. What are the other factors that lead to glaucoma? So we're working very, very hard on non-surgical and non-drug ways to lower eye pressure. And so we're hopeful in the next few years that we've got an answer that's safe for every type of glaucoma.
So prevention is a big part of this, but you mentioned earlier that we don't always know that we have it. So should we be getting checkups at certain ages just to see if we have this?
Glaucoma is one of the biggest reasons why we want people to get a yearly eye exam. If you're young, every couple of years is probably fine because glaucoma affects people that are more older. But if you're older, you really should be getting an eye exam with your local eye doctor every year or so.
Because I would say that, like for me, I wear contacts, so I do those yearly eye exams, but some people don't. So is that something that we should be doing, just kind of like an annual doctor checkup?
That's right. That's right. And you know, your local optometrist does a great job, but if your pressure is high, making you at risk for glaucoma, you can't tell. If you're losing your peripheral vision, you can't tell until it's so bad that it's really severe glaucoma. So if you're over age 50, you really should be getting an eye health checkup every year with your local eye doctor.
All right, thanks so much, Dr. John Berdahl, for joining us today.
My pleasure.
If you'd like to find out whether a MIGS procedure is right for you or want to schedule an appointment to find out whether you could be experiencing the signs of glaucoma, call them at 605-361-3973 or visit their website at vancethompsonvision.com.